Question 1. A hospital radiologic technologist is performing a routine chest X-ray on a patient who has recently undergone cardiac surgery. The patient has a pacemaker. What should the technologist do to ensure the safety of the patient during the imaging procedure? A. Ensure the pacemaker is turned off before the imaging procedure. B. Use the highest possible radiation dose to ensure the image quality. C. Follow the hospital's radiation safety protocols and use appropriate shielding around the pacemaker. D. Position the patient without considering the pacemaker's position in relation to the X-ray beam. Answer. C. Follow the hospital's radiation safety protocols and use appropriate shielding around the pacemaker. Explanation. When performing imaging procedures on patients with implanted devices such as pacemakers, the radiologic technologist must ensure the device is not subjected to unnecessary radiation exposure. The best practice is to adhere to the facility's radiation safety protocols, which include using the lowest possible radiation dose while maintaining image quality. Appropriate shielding techniques should be used to protect the device. It is also critical to position the patient in a way that minimizes radiation exposure to the pacemaker, ensuring patient safety during the procedure. Ignoring these protocols can result in potential damage to the device as well as an increased risk of radiation exposure. Question 2. Which of the following describes the correct sequence of actions when performing a scan on a patient with a suspected allergic reaction to iodine-based contrast media? A. Administer the contrast media and observe the patient for any reactions during the procedure. B. Stop the procedure immediately, notify the physician, and prepare for emergency management while observing the patient. C. Proceed with the scan as planned without administering the contrast media to avoid complications. D. Allow the patient to take antihistamines before the scan and continue with the procedure as scheduled. Answer. B. Stop the procedure immediately, notify the physician, and prepare for emergency management while observing the patient. Explanation. If a patient is suspected of having an allergy to iodine-based contrast media, the technologist must take immediate action to ensure the patient's safety. The correct course of action is to stop the procedure immediately and notify the physician for further instructions. It is crucial to prepare for emergency management and closely observe the patient for signs of an allergic reaction, which can include hives, shortness of breath, or swelling. Contrast media allergies should never be ignored, as they can escalate rapidly into severe anaphylactic reactions. Waiting to see if reaction occurs or proceeding with the scan without proper precautions could endanger the patient's life. Question 3. Mr. Smith, a 70-year-old male, comes into the imaging department for a chest X-ray. He is anxious due to the procedure and has difficulty staying still. What is the most appropriate way to handle this situation while ensuring image quality and patient comfort? A. Explain the procedure briefly and allow Mr. Smith to remain unassisted while taking the image. B. Restrain Mr. Smith to ensure he remains still during the procedure, as it is necessary for a good quality image. C. Provide Mr. Smith with emotional support, reassure him and assist him in maintaining proper positioning to reduce anxiety and ensure the quality of the X-ray. D. Take the image quickly while Mr. Smith is still anxious as speed. Prevent excessive radiation exposure. Answer. C. Provide Mr. Smith with emotional support, reassure him, and assist him in maintaining proper positioning to reduce anxiety and ensure the quality of the X-ray. Explanation. Effective patient communication and emotional support are crucial for successful imaging procedures, especially for elderly or anxious patients. In this case, it is essential to provide reassurance, explain the procedure in simple terms, and assist Mr. Smith with positioning. Ensure the X-ray quality. This approach helps alleviate anxiety and ensures the patient's comfort, which in turn leads to better cooperation during the imaging process. Restraining the patient or rushing through the procedure may increase anxiety and result in poor image quality. Calm, supportive approach is vital for both the physical and psychological well-being of the patient. Question 4. A 65-year-old female patient arrives for a mammogram. She has a family history of breast cancer and is anxious about the procedure. The technologist notices that the patient has dense breast tissue, which could affect the clarity of the mammogram. What is the best approach for the technologist to ensure optimal image quality and address the patient's concerns? A. Proceed with the standard mammogram as dense breast tissue does not affect the image quality significantly. B. Explain to the patient that dense breast tissue may affect image quality, but assure her that the mammogram will still be useful. Proceed with the standard procedure. C. Suggest additional imaging procedures such as ultrasound or MRI to compensate for the dense tissue. D. Use the highest possible radiation dose to improve the image quality due to dense breast tissue. Answer: B. Explain to the patient that dense breast tissue may affect image quality, but assure her that the mammogram will still be useful. Proceed with the standard procedure. Explanation: dense breast tissue can reduce the clarity of a mammogram, making it more challenging to detect abnormalities. However, the technologist should reassure the patient that the mammogram is still an important tool in breast cancer detection. The best approach is to explain the impact dense tissue on image quality and ensure the patient that the procedure is still valuable. If necessary, the technologist may also recommend additional imaging such as ultrasound or MRI based on the physician's guidance. It is not appropriate to increase the radiation dose, as this could unnecessarily expose the patient to higher risks without improving the diagnostic value. Communication and patient reassurance are key to managing anxiety and ensuring compliance with the procedure. Question 5. A radiologic technologist is preparing a patient for a ICNI with contrast. The patient informs the technologist that they have a known history of renal impairment. What should the technologist do next to ensure the patient's safety during the procedure? A. Proceed with the scan and use the contrast as usual, since renal impairment does not pose a significant risk. B. Notify the physician about the patient's renal impairment and inquire if an alternative imaging technique or non-iodine-based contrast media should be used. C. Decrease the contrast dose by half and proceed with the CT scan. D. Ask the patient to drink plenty of water before the scan to flush out the contrast media. The procedure. Answer: B. Notify the physician about the patient's renal impairment and inquire if an alternative imaging technique or non-iodine-based contrast media should be used. Explanation: renal impairment is a significant risk factor when using iodine-based contrast media, as it can lead to contrast-induced nephropathy. Sin. The best course of action is to notify the physician of the patient's renal history and consult about the possibility of non-iodine-based contrast or alternative imaging methods. The physician may suggest avoiding contrast altogether or using different imaging modality, such as MRI or ultrasound, to reduce the risk. Simply decreasing the contrast dose or encouraging fluid intake may not sufficiently address the risks associated with renal impairment. It is essential to prioritize patient safety by consulting with the physician and adjusting the imaging plan needed. Question 6. Mr. Anderson, a 50-year-old patient, is undergoing an abdominal X-ray. During the procedure, the technologist notices that Mr. Anderson is visibly anxious and is having difficulty holding still. What should the technologist do to improve the quality of the image while ensuring Mr. Anderson's comfort? A. Ignore the patient's anxiety and proceed with the exam quickly to minimize radiation exposure. B. Instruct Mr. Anderson to hold his breath and provide emotional support, encouraging him to stay as still as possible. C. Restrain Mr. Anderson to ensure that he holds still during the procedure. D. Offer the patient sedation to help him remain still and complete the procedure. Answer: B. Instruct Mr. Anderson to hold his breath and provide emotional support, encouraging him to stay as still as possible. Explanation: anxiety can significantly affect a patient's ability to remain still during imaging procedures, which in turn can affect image quality. The most appropriate response is to provide emotional support and instruct Mr. Anderson to hold his breath, as this will help minimize movement and improve the clarity. Image: providing reassurance and clear instructions on the procedure can alleviate anxiety, allowing the patient to participate effectively. Restraining the patient or offering sedation without proper indication is not recommended, as it could pose additional risks to the patient's safety and comfort. Communication, comfort, and clear guidance are essential to achieving high-quality diagnostic images while respecting the patient's emotional well-being. Question 7. A 30-year-old male patient is undergoing a chest X-ray as part of a routine screening. He has a history of smoking but denies any symptoms or chest pain. The radiologic technologist notices a subtle abnormality in the lung fields. The patient's medical history suggests possible early signs of emphysema. What is the most appropriate action for the technologist to take in this scenario? A. Document the findings, proceed with the exam, and send the images to the radiologist for interpretation. B. Inform the patient about the possible abnormality Ask him to return for follow-up exam and document the findings. C. Reassure the patient that the image appears normal, as smoking typically does not cause lung abnormalities. D. Immediately refer the patient to pulmonologist for further evaluation before completing the X-ray. Answer A. Document the findings, proceed with the exam, and send the images to the radiologist for interpretation explanation. As a radiologic technologist, it is important to perform the exam as prescribed and to document any potential abnormalities found. The technologist should not diagnose or offer medical advice, but should ensure the images are of high quality and then send them to the radiologist for interpretation. Radiologist is the medical professional who is responsible for identifying any potential pathologies, such as emphysema. The technologist should not inform the patient about the findings or advise on follow-up, as this is outside their scope of practice. The technologist's role is to capture accurate and comprehensive images and ensure proper documentation for further medical evaluation. Question 8. During an MRI procedure, the technologist notices that a patient's implantable cardioverter defibrillator (ICT) could pose a risk in the magnetic field. The patient is scheduled for MRI of the brain. What should the technologist do to ensure the patient's safety? A. Proceed with the MRI as planned, as ICTs are generally safe in the MRI environment. B. Immediately notify the physician and discuss alternative imaging options, such as CT or ultrasound, to avoid the risks associated with the MRI. C. Adjust the MRI parameters to minimize the effect of the magnetic field on the ICT. D. Ask the patient to remove the ICT before the procedure if possible. Answer. B. Immediately notify the physician and discuss alternative imaging options, such as CT or ultrasound, to avoid the risks associated with the MRI. Explanation. Magnetic resonance imaging (MRI) uses powerful magnetic fields, which can be hazardous to patients with certain medical implants, including implantable cardioverter defibrillators (ICTs). ICTs can malfunction due to the magnetic field, potentially leading to serious health complications. The technologist should never attempt to adjust MRI parameters or have the patient remove the device, as the ICT is implanted and cannot be removed without a medical procedure. The correct course of action is to notify the physician immediately to discuss alternative imaging modalities, such as CT or ultrasound, that do not pose the same risks. Physician may also consider modifying the patient's ICT settings or using specialized MRI-compatible equipment if necessary. Question 9. A patient arrives for a routine X-ray of the spine. During the examination, the radiologic technologist notices a history of recent back surgery, including the insertion of hardware. The patient appears to be experiencing mild discomfort but does not express major concerns. What is the most appropriate action to take when positioning the patient for the X-ray? A. Position the patient as comfortably as possible while ensuring the alignment of the spine for optimal imaging. B. Instruct the patient to lie flat on their back and hold the position for the duration of the exam, regardless of discomfort. C. Apply additional padding or support to help the patient feel more comfortable while maintaining proper positioning for the X-ray. D. Suggest rescheduling the exam for a later time to allow the patient to recover from surgery. Answer A. Position the patient as comfortably as possible while ensuring the alignment of the spine for optimal imaging. Explanation. When performing X-rays on a patient with a recent back surgery and the presence of hardware, the technologist must prioritize patient comfort while also ensuring proper positioning for the most accurate image. It is crucial to be mindful of the patient's discomfort due to surgery and avoid causing any unnecessary pain. Technologists should use padding and support to help the patient maintain proper positioning without exacerbating their discomfort. Simply telling the patient to lie flat without consideration for their comfort could result in further distress. Additionally, rescheduling the exam may not be necessary unless the patient is unable to tolerate the procedure or has significant pain that prevents proper positioning. The technologist's role is to find balance between comfort and need for clear diagnostic images. Question 10. A radiologic technologist is performing a fluoroscopy exam on a patient who is 20 weeks pregnant. The technologist must explain the risks of the procedure to the patient, who expresses concern about radiation exposure to her developing fetus. What is the most accurate information the technologist should provide about radiation exposure during fluoroscopy? A. Fluoroscopy uses minimal radiation, so it is safe during pregnancy as long as the procedure is brief. B. The amount of radiation used in fluoroscopy is significant and could harm the fetus. Therefore, the exam should be avoided if possible. C. Radiation exposure during fluoroscopy is safe for the fetus if appropriate shielding is used. D. The radiation used in fluoroscopy is minimal and poses no risk to the fetus. Answer: B. The amount of radiation used in fluoroscopy is significant and could harm the fetus. Therefore, the exam should be avoided if possible. Explanation: Fluoroscopy involves the use of continuous X-ray to create real-time images, and the amount of radiation exposure during the procedure is significantly higher than that of a standard X-ray. While the risk to the fetus depends on factors such as the dose of radiation, the gestational age, and the area being imaged, it is important to exercise caution when performing imaging procedures on pregnant patients. If the procedure is not urgent or essential, it is best to consider alternative imaging methods that do not involve radiation, such as ultrasound or MRI. The technologist should inform the patient about the potential risks and consult with the physician to assess whether fluoroscopy is absolutely necessary or if a safer alternative be used. Minimizing radiation exposure during pregnancy is a priority to avoid potential harm to the developing fetus. Question 11. A patient with a suspected fracture of the wrist is being prepared for an X-ray examination. The patient has a history of rheumatoid arthritis and uses immunosuppressive medications. What is the most important consideration for the radiologic technologist when positioning this patient for the exam? A. Ensure that the wrist is positioned in the most comfortable way possible to reduce pain. B. Use extra care to prevent additional injury due to weakened bone density from the disease. C. Avoid using lead shielding as it may interfere with the imaging process. D. Do not allow the patient to move the wrist and perform the exam without any adjustments. Answer: B. Use extra care to prevent additional injury due to weakened bone density from the disease. Explanation: Rheumatoid arthritis can lead to weakened bones and joints, which may make fractures more likely. The radiologic technologist must be careful when positioning the wrist to avoid further injury or stress to the already compromised bone structure. This may involve using gentle handling techniques and extra support to prevent damage. Ensuring comfort is important, but the primary concern in this case is the protection of the patient from any additional harm. Lead shielding should still be used to minimize radiation exposure to sensitive tissues, but this does not interfere with the imaging process. The technologist should also avoid immobilizing the wrist unnecessarily. Question 12. During a routine abdominal X-ray, the radiologic technologist notices that the patient is wearing a large metal belt buckle which could interfere with the image quality. The technologist does not want to delay the procedure. What is the most appropriate course of action? A. Take the X-ray as planned without removing the belt buckle, and the image will likely be fine. B. Ask the patient to remove the belt buckle before the X-ray, ensuring that it does not obstruct the area being imaged. C. Adjust the X-ray exposure settings to compensate for the interference from the metal buckle. D. Continue with the procedure but provide a disclaimer that the image might be compromised due to the buckle. Answer: B. Ask the patient to remove the belt buckle before the X-ray, ensuring that it does not obstruct the area being imaged. Explanation: Metal objects, such as belt buckles, can create artifacts on X-ray images that may obscure critical anatomical structures, leading to inaccurate interpretations. The best course of action is to ensure that the patient removes any metallic objects in the region being imaged. This will help to avoid potential distortion and ensure the diagnostic quality of the X-ray. It is important not to take a compromised image or adjust exposure settings to account for interference from foreign objects, as this may result in insufficient diagnostic information. Question 13. A pediatric patient arrives for a chest X-ray and exhibits some anxiety due to the unfamiliar setting. The parent is also anxious and the child is reluctant to lie down for the procedure. What is the most appropriate action the technologist should take to ensure a successful X-ray? A. Restrain the child to ensure proper positioning during the procedure. B. Use distraction techniques to calm the child and gain their cooperation while also reassuring the parent. C. Delay the procedure until the child is completely relaxed. D. Ignore the child's anxiety and proceed with the exam as quickly as possible to minimize the discomfort. Answer: B. Use distraction techniques to calm the child and gain their cooperation while also reassuring the parent. Explanation: When working with pediatric patients, it is important to address both the child's and the parent's anxieties. Using distraction techniques such as talking to the child, offering reassurance, or using a toy can help calm the child and facilitate cooperation without the need for restraint. Restraining children should be done if absolutely necessary, as it can increase anxiety and potentially cause distress or injury. By involving the parent in the process and providing reassurance, the technologist can help both the child and the parent feel more at ease, improving the likelihood of a successful procedure. Question 14. A patient arrives for a canny of the abdomen. The patient has a history of claustrophobia and is visibly anxious about the procedure. What is the most effective strategy the technologist can use to help the patient feel more comfortable during the scan? A. Explain the entire CT procedure beforehand, but avoid discussing the potential anxiety triggers. B. Encourage the patient to lie still without offering any additional support, as movement could affect the scan. C. Provide reassurance and let the patient know they can stop the procedure at any time if they feel uncomfortable. D. Ignore the patient's anxiety and proceed with the scan, as it is important to complete the exam as quickly as possible. Answer. C. Provide reassurance and let the patient know they can stop the procedure at any time if they feel uncomfortable. Explanation. Patients with claustrophobia may experience significant distress during CT scans, especially if the procedure involves entering a small enclosed space like the CT scanner. The most effective strategy is to provide reassurance, explain the procedure in a calm and clear manner, and let the patient know they stop the scan at any time if they feel uncomfortable. This gives the patient a sense of control and reduces feelings of anxiety. It is important to allow the patient to take breaks or reschedule if necessary, rather than forcing the procedure. Offering a supportive environment will help the patient feel more comfortable and improve the likelihood of completing the scan successfully. Question 15. A patient is undergoing a radiologic procedure involving contrast media, and the technologist is about to inject the contrast into the patient's vein. The patient suddenly complains of metallic taste in their mouth and mild nausea. What should the technologist do first? A. Immediately stop the procedure and call for emergency medical assistance. B. Inform the patient that the symptoms are normal and continue with the injection. C. Document the symptoms and proceed with the rest of the procedure. D. Stop the procedure, reassure the patient, and observe for any worsening symptoms. Answer. D. Stop the procedure, reassure the patient, and observe for any worsening symptoms. Explanation. A metallic taste and mild nausea are common side effects of contrast media during radiologic procedures, but they should not be ignored. The technologist should stop the procedure, reassure the patient, and observe for any further symptoms or signs of a more serious reaction, such as difficulty breathing or swelling. While these symptoms may be relatively mild, it is important to ensure the patient's safety and monitor for any signs of an allergic reaction or contrast-induced complications. If the symptoms worsen, the technologist should immediately notify the physician or seek emergency medical assistance. Continuing with the procedure without addressing the symptoms could lead to more severe issues. Question 16. A radiologic technologist is performing a chest X-ray on a patient with a history of COPD, chronic obstructive pulmonary disease. The patient has difficulty breathing and is in mild respiratory distress. What should the technologist do to ensure optimal image quality while minimizing discomfort for the patient? A. Increase the exposure time to capture a better image of the lungs. B. Have the patient take a deep breath and hold it as instructed, ensuring that the lungs are fully expanded. C. Decrease the number of X-rays taken to reduce exposure. D. Keep the exposure time brief and avoid asking the patient to hold their breath if it causes discomfort. Answer. D. Keep the exposure time brief and avoid asking the patient to hold their breath if it causes discomfort. Explanation. Patients with COPD may have difficulty holding their breath due to respiratory distress. In such cases, the technologist should avoid asking the patient to hold their breath for long periods and instead keep the exposure time as brief as possible to minimize discomfort. The technologist may also need to adjust positioning and techniques to capture clear images without requiring the patient to hold their breath for extended periods. Increasing exposure time could compromise image quality and increase patient discomfort, while reducing the number of X-rays may not always provide the necessary diagnostic information. Question 17. A patient is scheduled for an MRI of the brain, and the technologist is reviewing the patient's medical history. The patient mentions that they have a pacemaker. What is the most important consideration before proceeding with the MRI? A. The MRI should proceed as scheduled, as pacemakers no longer pose a significant risk during MRI scans. B. The technologist should contact the physician to confirm whether it is safe to perform the MRI based on the type of pacemaker. C. The patient should be given medication to relax them before the MRI to minimize any discomfort. D. The technologist should remove the pacemaker before the MRI. Answer: B. The technologist should contact the physician to confirm whether it is safe to perform the MRI based on the type of pacemaker. Explanation: many pacemakers are not MRI compatible and could be affected by the magnetic fields in an MRI scanner, leading to potential harm to the patient or malfunction of the device. Before proceeding, the technologist should consult with the physician to determine whether the pacemaker MRI is safe or if an alternate imaging method should be considered. This is especially important as the risk varies depending on the type of pacemaker and the technology used in the device. Question 18. A patient arrives for an abdominal ultrasound and the technologist notices that the patient is pregnant. What should the technologist do in response to the patient's pregnancy status? A. Proceed with the ultrasound without concern, as ultrasound is considered safe during pregnancy. B. Inform the patient that the procedure is unsafe for pregnant women and cancel the exam. C. Modify the procedure to minimize exposure to the unborn fetus, even though ultrasound is typically safe. D. Proceed with the ultrasound but use higher levels of energy to get a clearer image. Answer: A. Proceed with the ultrasound without concern, as ultrasound is considered safe during pregnancy. Explanation: ultrasound is a safe imaging technique and is commonly used during pregnancy to monitor the development of the fetus. It does not involve ionizing radiation, making it a preferred method for imaging pregnant patients. The technologist should proceed with the exam as usual, ensuring the comfort of the patient and following the standard procedure. For an abdominal ultrasound, there is no need to alter the procedure, as ultrasound has been shown to have no known adverse effects on pregnancy when performed properly. Question 19. During a radiographic examination of the lumbar spine, the radiologic technologist notes that the patient is experiencing significant pain when being positioned. What is the most appropriate course of action? A. Continue the exam quickly to minimize the time the patient spends in discomfort. B. Pause the procedure, adjust the positioning for comfort, and consider using support devices to relieve pressure on painful areas. C. Perform the exam without adjusting the patient's position, as moving the patient could cause further pain. D. Use restraints to immobilize the patient and prevent movement during the procedure. Answer: B. Pause the procedure, adjust the positioning for comfort, and consider using support devices to relieve pressure on painful areas. Explanation: when a patient is in significant pain, it is essential to prioritize their comfort and safety during the examination. The technologist should pause the procedure, assess the patient's level of discomfort, and adjust the positioning to relieve pressure on sensitive or painful areas. Using supportive devices such as pillows or cushions can help improve the patient's comfort and allow for a more accurate and effective exam. Restraining the patient is generally not recommended unless absolutely necessary, as it could increase the patient's distress. Question 20. A patient is undergoing a fluoroscopic examination of the gastrointestinal system. During the procedure, the technologist notices that the patient is visibly anxious and shaking. What is the best approach to managing the patient's anxiety during this procedure? A. Ignore the anxiety and continue the procedure to avoid delays. B. Reassure the patient, explain the procedure in detail, and offer breaks if needed to help the patient relax. C. Encourage the patient to hold their breath for the entire duration of the procedure to reduce anxiety. D. Increase the radiation dose to complete the procedure faster. Answer: B. Reassure the patient, explain the procedure in detail, and offer breaks if needed to help the patient relax. Explanation: fluoroscopic procedures can be anxiety-inducing, especially if the patient is unfamiliar with the process. The technologist should take time to reassure the patient and explain the procedure in a calm and clear manner. Offering breaks if the patient feels anxious or uncomfortable can help alleviate stress and ensure the procedure is completed successfully. Ignoring the patient's anxiety may lead to further distress, and increasing the radiation dose is never appropriate, as minimizing radiation exposure is always a priority. Question 21. A patient is scheduled for a ischemia of the abdomen. The technologist notices that the patient has a history of severe allergies to contrast media. What is the best course of action for the technologist? A. Proceed with the CT scan without contrast, as the patient is allergic to the contrast media. B. Inform the physician, who will decide whether a non-contrast CT scan is appropriate or if premedication is required. C. Continue with the CT scan but use A lower dose of contrast to minimize the allergic reaction. D. Use a different type of contrast media that is less likely to cause an allergic reaction. Answer B. Inform the physician, who will decide whether a non-contrast CT scan is appropriate or if premedication is required. Explanation: severe allergic reactions to contrast media can be life-threatening, so it is important for the technologist to communicate the patient's history to the physician. The physician can then determine whether it is safe to proceed with the contrast-enhanced CT scan or whether an alternative imaging method like non-con CT should be considered. In some cases, premedication can be prescribed to reduce the risk of an allergic reaction, but this should only be done under the guidance of a physician. Question 22. A patient undergoing a chest X-ray is unable to stand due to a severe leg injury. What should the technologist do to ensure the quality of the image while accommodating the patient's condition? A. To perform the X-ray while the patient is lying down, ensuring the central ray is aligned properly. B. Ask the patient to attempt standing despite their injury, as this will provide the best image quality. C. Use a portable X-ray machine to take the image in the patient's home. D. Cancel the X-ray until the patient is able to stand for the procedure. Answer A. Perform the X-ray while the patient is lying down, ensuring the central ray is aligned properly. Explanation: if a patient is unable to stand, the technologist can perform the chest X-ray in a supine position, lying down, while making sure that the central ray is aligned appropriately to ensure accurate imaging. Adjustments may be needed to the positioning of the X-ray equipment, but there is no need to cancel the procedure. Asking the patient to attempt standing could worsen their injury, and performing the exam at home is not feasible in most settings. Question 23. A patient is pregnant and requires a dental X-ray. What is the best way to proceed with this imaging procedure? A. Proceed with the X-ray, as dental X-rays pose minimal risk to pregnant patients. B. Postpone the X-ray until after the pregnancy, as no imaging should be done during pregnancy. C. Inform the physician about the pregnancy use a lead apron to protect the patient and ensure the exposure is minimized. D. Proceed with the X-ray without additional protective measures, as the radiation dose is very low. Answer C. Inform the physician about the pregnancy. Use a lead apron to protect the patient and ensure the exposure is minimized. Explanation: for pregnant patients, the use of imaging techniques that involve ionizing radiation, such as X-rays, should be approached cautiously. In this case, the technologist should inform the physician about the pregnancy and assess whether the X-ray is essential. If the X-ray is necessary, a lead apron should be used to protect the fetus from radiation exposure, and the exposure should be minimized. Postponing the X-ray or avoiding it altogether may be advisable if the procedure is not urgent. Question 24. A patient who has recently undergone a contrast-enhanced CT scan is complaining of a mild itching rash on their skin. What should the technologist do? A. Ignore the symptom, as it is a common and harmless side effect of the contrast. B. Advise the patient to take antihistamines and send them home. C. Immediately inform the physician, as it may be an early sign of an allergic reaction that could progress to a more serious condition. D. Encourage the patient to rest and wait for the rash to go away on its own. Answer C. Immediately inform the physician, as it may be an early sign of an allergic reaction that could progress to a more serious condition. Explanation: mild itching or a rash after contrast administration can be an early sign of an allergic reaction. Although these symptoms may not always be serious, it is important for the technologist to inform the physician immediately. The physician can assess the patient for potential signs of a more severe allergic reaction, such as difficulty breathing, and take appropriate action. Ignoring the symptom or advising the patient to manage it on their own could delay necessary medical intervention. Question 25. A pediatric patient is undergoing an X-ray of the wrist. The technologist is concerned about the potential for the child to move during the procedure, which could affect image quality. What is the best approach to prevent motion during the exam? A. Use a higher radiation dose to ensure that the image is clear even if there is movement. B. Ask the child to hold their breath for as long as possible to avoid motion. C. Provide the child with a toy or distraction to help them stay still during the exam. D. Restrain the child physically to ensure no movement during the procedure. Answer C. Provide the child with a toy or distraction to help them stay still during the exam. Explanation: for pediatric patients, it is crucial to minimize motion without resorting to the use of restraints or excessive radiation. Using the toy or other distractions is an effective way to keep the child calm and still during the procedure. It is also helpful to explain the procedure in a way that reassures the child and helps them understand. Is expected. Increasing radiation or physically restraining the child should be avoided unless absolutely necessary, as both approaches can increase risks or distress. Question 26. A patient is undergoing an MRI of the knee but has a pacemaker. What should the technologist do before proceeding with the exam? A. Proceed with the MRI since the pacemaker is not relevant to the imaging procedure. B. Inform the physician as the pacemaker may pose a contraindication to the MRI. C. Ask the patient to remove the pacemaker to avoid interference with the MRI. D. Continue with the MRI but decrease the magnetic field strength to avoid affecting the pacemaker. Answer. B. Inform the physician as the pacemaker may pose a contraindication to the MRI. Explanation. MRI exams use strong magnetic fields that can interfere with pacemakers and other implanted medical devices, potentially causing malfunctions or harm. Before proceeding with an MRI, the technologist must inform the physician to assess the risks and determine whether the MRI is safe for the patient. The physician may decide to proceed. Alternative imaging techniques to take precautions such as using a non-magnetic pacemaker, depending on the patient's medical history. Question 27. A patient with a history of kidney problems is scheduled for an intravenous pyelogram. What should the technologist do before the procedure? A. Proceed with the IP without any additional precautions, as kidney problems do not affect the contrast media. B. Inform the physician about the patient's kidney history, as they may need to adjust the contrast dose or consider an alternative imaging technique. C. Use higher dose of contrast to ensure the kidneys can filter it properly. D. Ask the patient to drink large amount of water before the procedure to improve kidney function. Answer. B. Inform the physician about the patient's kidney history, as they may need to adjust the contrast dose or consider an alternative imaging technique. Explanation. Patients with kidney problems are at higher risk of contrast-induced nephropathy, which can cause kidney damage. Therefore, it is important for the technologist to inform the physician about the patient's history before proceeding with an IV. The physician may decide to adjust the dose of media, choose different imaging method, or take additional steps to minimize risk, such as prehydration or monitoring kidney function during and after the procedure. Question 28. A patient presents for an X-ray of the chest, but their medical records indicate a history of tuberculosis (TB). What is the best action for the technologist? A. Proceed with the chest X-ray without taking any special precautions. B. Perform the X-ray using a lead shield to prevent any contamination from TB. C. Use airborne precautions, such as wearing a mask, and ensure the patient wears a mask during the procedure. D. Postpone the X-ray until the TB condition is fully treated. Answer. C. Use airborne precautions such as wearing a mask and ensure the patient wears a mask during the procedure. Explanation. Tuberculosis (TB) is a contagious disease that can be transmitted through airborne droplets. If a patient with a history of TB is undergoing an X-ray, the technologist should follow airborne precautions to prevent the spread of the disease. This includes wearing a mask and ensuring that the patient also wears one during the procedure. The room should also be well ventilated. The X-ray should be performed with the appropriate precautions, and it should not be postponed unless medically necessary. Question 29. A patient is undergoing a lumbar spine X-ray and the technologist notices that the patient is wearing a thick metal belt. What should the technologist do before taking the image? A. Ask the patient to remove the metal belt before the procedure. B. Perform the X-ray without asking the patient to remove the belt, as the metal will not interfere with the image. C. Only ask the patient to remove the belt if the image quality is compromised. D. Place the belt in the imaging area to act as a protective shield for the spine. Answer. A. Ask the patient to remove the metal belt before the procedure. Explanation. Metal objects, such as belts, can cause significant artifacts and interference in radiographic images. To obtain a clear and accurate X-ray of the lumbar spine, the technologist should ask the patient to remove the metal belt before proceeding. This will prevent the metal from obstructing the X-ray beam and producing distortions in the final image, which could lead to incorrect diagnosis or the need for repeat imaging. Question 30. A patient is scheduled for a mammogram and expresses anxiety about the procedure. What should the technologist do to alleviate the patient's concerns? A. Ignore the patient's anxiety, as the procedure is straightforward and doesn't require additional communication. B. Explain the procedure to the patient in simple terms, answer any questions, and reassure them about the importance of early detection. C. Rush through the procedure to minimize the patient's stress. D. Recommend that the patient postpone the procedure until they are less anxious. Answer: B. Explain the procedure to the patient in simple terms, answer any questions, and reassure them about the importance of early detection. Explanation: mammograms can be intimidating, especially for patients who are experiencing anxiety about the procedure. The technologist's role includes providing reassurance by explaining the process in a calm and clear manner. Addressing the patient's questions and concerns will help reduce anxiety, ensuring the patient is more relaxed and able to cooperate during the exam. Reassuring the patient about the benefits of early detection and the steps the technologist will take to ensure their comfort can also help alleviate fear.